Welcome everyone to the first CCSP resource fair meetup for food security. This meeting is being hosted and co-hosted by the Colorado Alliance for Patient Navigators and Community Health Workers with support from the Patient Navigation Training Collaborative. I know some of you I have met there in class, so I'm glad you could join us. My name is Rena Solar. I am the program coordinator for the Colorado Cancer Screening Program. We're known as CCSP, and we are a statewide program that is coordinated through the University of Colorado Cancer Center. We partner with safety net hospitals and clinics to support clinic teams with delivering patient navigation. Services to medically underserved for preventive cancer screening. That includes colorectal cancer, lung cancer, and hereditary cancer risk assessments. So the purpose of this meeting for the resource fair is to connect patient navigators to different resources that can assist your patients with local resources from community organizations to meet the needs of the clients they serve. So in this meeting, you'll hear from two different organizations regarding food security. The first presenter is Brandy Brogan, who will be sharing information about Project Angel Heart. And the second is Tamara Orndoff. Did I pronounce that right? With Benefits in Action. Okay. And you will have the opportunity to join a breakout room after both of them present. You'll get to choose your breakout room. And this is a time for you to ask the presenters questions, share additional perspectives about resource needs, challenges, and what has been helpful for you in your own personal work. So I am just going to go to the next slide here, give you a little overview of the agenda. So yeah, kind of basic of what I just said. And then I also wanted to give a little announcement just in case some of you have to hop off early, but we are doing a second resource fair. There are 5 in total. So the next one will be March 22nd. Same time, also on a Tuesday, and this will be for resources for shelter and housing assistance. So let me go ahead and hand it over to Elsa for some reminders.
And just a reminder for tech, you can let us know if you have any issues with audio connecting or anything like that, but please stay muted throughout the presentations and then save your questions to ask the presenters directly in those breakout rooms. We want this to be just a quick opportunity, knowing some people might have to hop off before the end to really get the information you need. So we really want to encourage you to save your questions for that breakout room so that you have the opportunity to engage in discussion with the presenters in a more personal manner. And you will have the opportunity to meet with both of the presenters today. And with that, I'm going to turn it back over to Rena to introduce our first presenter.
All right, Brandy, I will go ahead and give you the stage. Brandy Brogan works for Project Angel Heart. Yeah, I'll let you give more of an introduction for yourself then. Thank you.
Perfect, thank you. So my name is Brandy Brogan. I am the Director of Client Services at Project Angel Heart. Bear with me while I get to the beginning of this. There we go. And today I want to talk to you about food as medicine and what Project Angel Heart does. So we've known since the beginning of time that, as Hippocrates said, let food be thy medicine and medicine be thy food. And that's something that's important to us as well. And we want to be able to help the communities by providing our services. So I'm going to run through this quickly because there's a lot, but we are located in the Denver metro area. This is kind of a picture of our building. We have our own professional kitchen and chefs who prepare all of our meals from scratch every day. And then we provide those meals to individuals who have a severe illness and are in need of support. So we're able to do that. A lot of people have to choose between food, medicine, and housing. And we all know that that has only gotten worse over the last couple of years. Food prices have skyrocketed, medications have really gone up, and housing in Colorado is insane. So we want to help alleviate some of that stress by providing food, and medically tailored food at that is appropriate for people's health issues, so they're not having to make those decisions between housing, medications, and food. We do a lot of research about our meals and about the importance of nutrition, and we do have that information on our website. But I did want to just touch a little bit of base on one study that we recently did. We did a retrospective study that looked at people prior to having our services, during, and then after, and compared that to a control group. And we saw reductions in 30-day all-cause hospital readmissions, reduced inpatient costs, significant reductions in total medical costs, particularly for those that were diabetic, had heart failure, COPD, or end-stage renal disease. We've also worked with Telegen to match our meals with their diabetes management program. And we saw weight loss and weight gain as needed, improvements to systolic blood pressure, and improvements in behavioral and mental health, which was just amazing. So we've been doing this since 1991. And as I said, all of our meals are made from scratch every day. And we cook from a variety of diverse cultures and different cuisines to make sure that our meals are meeting the needs of folks. We have a few different programs, and you will get a copy of these slides after. So I do want to just let you know, you don't have to remember all this. But our main program that most of you are probably aware of is our core program. And we provide meals for people who have a severe illness in the Denver Metro, Boulder, Colorado Springs, Fountain, Castle Rock, and Pueblo areas. Those areas are currently expanding. It is our hope in the next 4 years to serve 75% of the urban Front Range corridor. So just be aware that that will expand from Fort Collins to Pueblo. So just keep an eye on our website, and you will see updated changes as we add new areas. Pueblo was just this past week, so we're very excited about that. We have no age or income restrictions for our program. And meals are provided to dependents as well. So if I were sick, we'd provide meals to my kids. And then we also provide meals for undocumented individuals. That does not play a role in whether or not our services are available. We also have a few Medicaid programs. So we're able to provide meals in Region 4, which is Health Colorado. And there are a bunch of counties listed here. For folks that are diabetic, have COPD, heart failure, or high-risk pregnancy. And for those folks, we'll provide 7 entrees per week for 8 weeks, and we'll include nutrition education during that time. For Region 6 and 7 with Medicaid, that is CCHA, they provide meals in these counties, and we'll provide the same services to them as well. And that program is specific for diabetics who have a recent hospitalization. So we have a few options there. So here's a map of the areas, just to give you an idea. So the yellow area is Region 4. So that is the heart failure, COPD, diabetic, and high-risk pregnancy. And then the green and dark, lighter blue areas here are the diabetics who are recently hospitalized. And then our core program is in that Front Range corridor, as I talked about. All of our meals are medically tailored, and we care about the quality of the meals in addition to the product that we're sending out. So all of our beef is antibiotic free, our chicken is organic or antibiotic free. All of our fish is sustainably raised and harvested. We have our own greenhouse and garden beds where we grow a lot of our own herbs and stuff. So we really do care about the quality of the meals. Here's kind of what a meal would look like, the anatomy of it. So we have our appropriate carbohydrates, lots of vegetables, healthy fats, and protein. All of the meals come frozen, and then they can just heat them up as they need them. And we can accommodate several different diets, as I had mentioned. So we have a renal diet, allergy-friendly, unseasoned, vegetarian, low-sodium diabetic. And then we can also restrict for things like less gassy foods, or people that are on blood thinners or have dexterity issues, stuff like that. With our shipping program, we're able to ship statewide through some of those other regions through healthcare contracts. So that's super exciting. And if you want to learn more about that, hit me up in the next one. And through those healthcare contracts, we've been able to actually serve all of these areas, which is really exciting that we've been able to do that. So how to sign up. So we have an application for our core program and we have an application for the Medicaid programs. Those are separate. You would just fill that out and you can mail it, email it, fax it, whatever you need to do to get it back to us. And then we'll go through and set up services. And I do have a tour listed on here as well. So I highly recommend checking it out so you can see our kitchen. But our meals are free of charge to our patients. There is no charge. As I said, we're just trying to help people when they're in need and when they have those illnesses. Typically, it's things like cancer, heart failure, kidney disease, stuff like that. So as you have patients that are coming in and out, let us know. But we have hundreds of illnesses in our database. So if you ever have questions, we're happy to answer those. It's not a medical order per se. It's just has to be filled out by a medical professional to verify the diagnosis information. We want to make sure that we're serving those that are most in need. And we know that it impacts their health, but we've also asked clients how else it impacts them. And they talk about improvements in their quality of life, less stress, healthier eating habits because they know what they should be eating. They're able to remain independent in their home and afford their basic needs. So it's really a great service that we're able to provide. And our clients are really grateful for that. Here's my contact information, and I will share that again with you in a breakout session and answer any questions that you may have. And hopefully that was 5 minutes or less.
Oh, that was perfect. Thank you so much for sharing, Brandy. That's a lot of great information. Yeah, and it seems pretty easy just to click on those sites as well, or those registration links. All right. And I will pass it off to Tamara Orndoff, and she is from Benefits in Action, and I will give you the floor now.
Hi, everyone. My name is Tamara, and I am with Benefits in Action. We were looking at this slide when we first started, so I apologize for not being on page 1. Here we are. So Benefits in Action is located in Lakewood, Colorado. We have been around since about 2015. And I just wanted to say happy Tuesday to everyone here. It's a special day for us all. Benefits in Action is a nonprofit organization dedicated to supporting our diverse community with a focus on elderly and underserved to improve their understanding, access, and utilization of food and health-related benefits to enhance food security, health, and well-being. Benefits in Action's foundation for what we do is helping people with application assistance. However, we do also do educational presentations for a variety of different groups. And then also we have partner presentations where we coordinate different, we have partners come in and teach us things, and we also go out and teach people about our services as well. For our application assistance, we do cover Medicaid, Medicare, food stamps, Connect for Health, Live, SNAP, food pantries, food delivery, and of course we help with dental, heating assistance, rent, transportation, and we have a mental health program. But today we're here to talk specifically about food. So I welcome any other questions when we go into the breakout, but I didn't want to spend too much time on everything we do because Benefits in Action has a lot of opportunities. So when COVID first started, Benefits in Action decided that, there's a lot of people that were unable to access food. So we started delivering food to people who were homebound. And we found that this program was very successful because there's a lot of people that are unable to get out of the house due to a disability, maybe a lack of transportation, a lack of gas. We have also found that there's people who are caregivers who, are extremely overwhelmed with their jobs and they don't have time to take care of themselves. So, this type of food delivery to people's front door has been helpful to a wide variety of people. So we are focusing on people who are hungry and need food resources. But while we're delivering and talking with these people, we also try to extend our services to people to see what other needs they may have. So we do extend, the opportunity to do food stamp application with them, Medicare, any other type of service or application assistance that they need. Underserved and older adults, they struggle with multiple barriers to accessing healthy food and food in general. And Brandy had a really great overview of some of the benefits of eating healthy. But it's critical to acknowledge the importance of providing that nutritional education, especially with food delivery to their door. So let's consider some barriers. One would be affordability of nutrient-dense foods that can prevent homeless and older adults from choosing healthier options. Another is food safety and storage capabilities that limit the types and kinds of food that they can purchase and keep. Another is limited access to resources needed to prepare and cook meals, often limits the foods that they can eat from the grocery stores and food banks. A lack of access to healthcare and services, along with limited food supply, leave underserved and older adults vulnerable to chronic disease and illness. For example, we've worked with folks who have rotting or no teeth, and that can prevent them from eating a wide variety of foods. A lack of transportation, as I said before, places another barrier on accessing food. Bus rides can take hours to get to the supermarket, grocery store, or farmer's market. Homeless people also and elderly may not have the money to pay for that public transportation. This can limit their time shopping and even limit them to only shopping at the corner stores that are close to where they stay. And some people actually, may live in their car and have limited resources to pay for gas, or their car may not be operating. So we do focus in, when we are serving foods in these boxes, delivering foods, we look at certain things like these pop tops, because pop tops don't need a can opener and they are a lot easier to open for people who have arthritic hands. We also try and focus on, the low sodium and low sugar options in our food boxes when available. We have a perishable and a non-perishable items. Usually we get, this is an example of our perishable food box. Usually we will have one of these and then a non-perishable and then a bag, maybe some cheese, milk, eggs. We also have a variety of volunteer opportunities for our food delivery program. We have an event once a month, and then we also have delivery Tuesday through Saturday. And drivers come through, they show up at our warehouse. It's on Jason Street. If any of you know where the Mile High Comics is at, we are right next door to that. They show up and we load up their car. We give them a route of generally about 5 clients that need food, and they bring it to their door and drop them off. We do not have any rules. Homebound is the only thing we ask for. So basically, if you need to get a hold of us, if you have a client that needs food delivered to their home, you can always call us at 720-221-8354, option 6, or you can go to our website. I also will share an email address with you all too, because if you have someone in one of these counties, Denver, Jefferson, Adams, or Arapahoe, you can send us a direct email and let us know that you have a client in need. I hope that wasn't too fast, and I hope that was thorough enough for you, and I welcome any questions in the breakout room. Thank you.
Thank you so much for providing that. Yeah, very insightful. And like you said, you guys offer a lot. So just to focus on the food is extra great for this. So, all right, I am going to go ahead and open the breakout rooms. Like we said, everybody can pick which organization. Do keep in mind that you will get to switch organizations in about 10 minutes or so. So if you have questions, no need to leave this one early to go to the other one. You'll have plenty of time. So David, I did put you in with benefits in action with Tamara, and then Elsa will be with you, Brandy. All right, I'll go ahead and open these up, and thank you both for your presentations.